A new state agency reports spending on healthcare is rising above the rate of inflation. Some other figures show healthcare spending is leveling off, but the Center for Health Information and Research has put a spotlight on the rising spending in the state's largest provider network and by its leading insurer. I'd like to welcome as our guest from the center, the Executive Director, Aron Boros. Thank you very much for being with us, Aron.
Nice to be here.
We've seen a couple of different sets of figures lately. Your figures about the increase. I've seen these other figures saying that the healthcare spending in Massachusetts and the country is leveling off. So what is going on?
It depends on what you measure. So if you look at our report, we see two different things. One is the amount of money going to providers for healthcare is increasing, slowly, but it's increasing. On the other hand, we see premiums are flat. So the actual amount that you're paying for your insurance is flat. And those two things in our own report are a little bit out of sync. And what we think is going on is that there's actually smaller administrative expenditures at the health plans. So your premiums are flat, your medical expenditures are going up a little bit, and what's getting squeezed is the administrative expenses.
Talk about the places where you see the most noticeable increase right now.
I think actually the right thing to talk about is how non-noticeable the increase is. So if you look back a decade, our increases were on the order of 5% a year, 6% a year, 7% a year. I think there were years that we had 9% increases. And this year we found that the increase was just 2.3%, which is a little bit faster than inflation, but slower than the overall economy and way slower than we've seen for years. And so it's true that there are plans and providers who kind of move on one side or the other of that 2.3% number. But overall, this is a step in the right direction for the overall trend. Looking below that at what is going on at different plans and providers, we do see the largest providers and the largest plans tend to have higher increases in the way that we measure them. But it's the kind of thing we have to look at year over year and really see if there's a trend.
Well, partners, they're the largest. They have an increase. I guess that's worth talking about. Any idea what's driving that?
Yeah, and partners sticks out in our report, more so probably than anybody else. And that's because we looked at their performance in 3 different health plans. That's Blue Cross Blue Shield, Tufts, and Harvard Pilgrim, which make up maybe 80% of people who are in the commercial market. And at all 3 of those plans, partners is getting more expensive, and they are remaining outliers relative to their competitors as being more expensive plans. We don't really know what's driving that. We do know a couple of things, though. Primarily that the prices at partners hospitals and physician groups tend to be among the higher prices for all hospitals and physician groups. But there's other things going on, too. We also know that the big academic medical centers like Brigham and Women's Hospital and Massachusetts General Hospital are taking care of some of the sickest patients. And so there's a question about how much of this is price, how much of this is just the complexity and the illness of the patients. And then there's another unanswered question about quality. So you might think that the partners hospitals cost more, but maybe they also are providing higher quality care. And we took a look at that, and we couldn't see a relationship between the quality of the care and the price and the cost. It's not to say there's no relationship. It's hard to measure quality in the healthcare world, but it's not something that we could tease out based on available data.
Interesting now with their attempt to expand, and on the one hand, there's a potential there for sending more patients to less expensive settings for treatment, but there's also potential for bringing in more people for the expensive treatment.
Right. And it's hard to know where the balance lies. So my agency doesn't take a position on whether that's a good idea or not. There's another state agency called the Health Policy Commission that has looked specifically at some of the plans of the partner system, and they found that on balance, they believe it would drive costs up. But I think that's a complicated question that a number of people have been taking a look at.
One problem we've had for many years, and there have been attempts to deal with this, is to have care better coordinated, have people deal with things in a primary care setting instead of having a crisis that's more expensive to handle. How are we doing with that?
So if you go back 10 years in Massachusetts, or really today in almost any other part of the country, most doctors and hospitals are paid for every visit, every surgery, every admission to the hospital. And there's a concern there that because they're paid on what's called a fee-for-service basis, there's no reward for coordinating care, and there's no reward for providing efficient care. And so what we're doing in Massachusetts is pretty unique relative to other states, where we're giving primary care physicians more responsibility for the total cost of care. And what that means is now the primary care physician can say, well, if I answer some more emails, which usually under a fee-for-service system I wouldn't get paid for, or a great example is asthma initiatives, where they actually pay for air conditioners and to take carpets out of houses with children with asthma. That stuff might not be paid for under a fee-for-service system, but under these new systems where they have responsibility for the coordination of care, they can actually pay for those non-traditional services, but then receive some of the reward of managing the patient more efficiently. We call that a global budget because the doctor is responsible for the global cost of care for the patient for the first time. And we've found that global budgets in Massachusetts are adopted at a much higher rate than any other state. And although it's not growing terribly fast, we're in about a third of patients are associated with one of these arrangements, whereas in other states we think maybe 5% of patients are in that situation.
And you just explain that example a bit, because if you eliminate some of these asthma triggers in the home, you can save a lot of money for the provider and a lot of grief for the family.
Right. I mean, that's the real dream of coordinated care, is that you keep, this is a great story because it's children. You keep children out of the emergency room. That saves money. It makes the quality of life for the kids better. It gets them in school longer. It saves, and it's good for the parents who don't have to take off time from work. And so the trick is to create economic incentives in the system that allow your physician to help you with that. I gave some examples, but another one is community health workers. Somebody might go and visit you at home and help look at your house and see ways that you can make changes that benefit your children. Again, in the previous system, the doctor wasn't paid for that kind of work. And this system gives them new reason to invest in those ways that are non-traditional, but we think very effective.
We've had broad coverage in the state for a number of years now, but do you see the new federal Affordable Care Act changing this much one way or the other?
It's a hard question to answer. So we've had coverage levels around 97% for a while. We'll know later this year if that's been affected one way or the other by the Affordable Care Act. The truth is, the insiders in Massachusetts government, there's been a lot of effort to implement the Affordable Care Act. But all of that effort that we've gone through has been with the goal of having it have minimal impact on the residents of Massachusetts. So my hope is that the residents of Massachusetts see continued high levels of coverage and hopefully cost reduction under the Affordable Care Act. And that the complexity under the hood is really hidden from the average person. And so far we've seen preliminary sense that that's true. Despite some well-publicized trouble with the website for the Affordable Care Act, the truth is we continue to see high enrollment levels at all the plans, including MassHealth, the Medicaid program, but also at the commercial plans. And we see relatively few disruptions based on the Affordable Care Act, which is an early positive sign, although something clearly we need to keep looking at.
Thank you very much for being with us.
Yep,
Aron Boros from the Center for Health Information and Analysis. We'll have more news in just a moment.